Please be advised that the information provided in this video is for educational purposes only and should not be considered medical advice. The speakers are not medical professionals, and the content discussed should not be used to diagnose or treat any health condition. Always consult with a qualified healthcare provider before making any decisions related to your health or treatment, including the use of any medications. The information presented reflects the speaker's opinions and interpretation of available research at the time of recording and may not be exhaustive or reflect the latest findings. Individual results and experiences with medications can vary significantly. GLP-1 agonists, the full picture GLP-1 agonists. Hello everyone and welcome back to the channel. Today we're embarking on a comprehensive exploration of GLP-1 agonists, a class of medications that has moved from the realm of diabetes management into the forefront of weight loss discussions. Medications like Ozempic and Wegovy have captured widespread attention, and for good reason. These aren't just simple appetite suppressants, they interact with complex hormonal pathways in our bodies. In this detailed analysis, we'll delve into the intricate science behind GLP-1, tracing its discovery and meticulously examining the multifaceted ways it influences our physiology. We'll leave no stone unturned as we discuss the potential benefits, the acknowledged risks, and the often overlooked long-term implications of using these powerful therapeutic agents. Understanding the nuances of GLP-1 drugs is crucial in navigating the evolving landscape of weight management and metabolic health. Join us as we dissect the evidence and strive for a balanced perspective on this significant area of medical science. The initial foray into utilizing GLP-1-based drugs was rooted in their ability to manage type 2 diabetes. At the originally prescribed lower dosages, the primary mechanism of action was the targeted inhibition of glucagon, a hormone that raises blood sugar levels. By modulating glucagon release, these drugs effectively contributed to improved glycemic control in diabetic patients. However, astute clinical observations by researchers revealed an intriguing secondary effect. Many individuals receiving these treatments reported a diminished appetite and an earlier onset of satiety during meals. This subtle yet significant change in eating behavior often correlated with modest weight loss in these patients. These serendipitous findings ignited a new avenue of research and development, leading to the creation of higher-dose formulations of GLP-1 agonists, specifically intended for weight management. It's a fascinating aspect of pharmaceutical science that often the core molecular structure of a drug remains consistent, while alterations in dosage can unlock entirely different therapeutic applications. Regulatory frameworks and patent laws further contribute to this phenomenon, allowing for the patenting of specific dosage ranges for a given molecule, effectively creating distinct drug products with unique marketing and intellectual property protection. At these elevated dosages, the physiological effects of GLP-1 receptor agonists become more pronounced and widespread. One of the primary mechanisms driving weight loss is the direct interaction with satiety centers within the brain, particularly in the hypothalamus. GLP-1 acts as a signaling molecule, conveying a sense of fullness and satisfaction after eating, thereby reducing the drive to consume more food. Simultaneously, GLP-1 exerts a significant influence on the digestive system by slowing down the process of peristalsis, the rhythmic contractions of the intestinal muscles that propel food through the digestive tract. This delayed gastric emptying contributes to a prolonged feeling of fullness, further aiding in calorie reduction. However, this deliberate slowing of gastric motility can present clinical challenges. A particularly relevant concern arises in the context of surgical procedures requiring general anesthesia. Standard preoperative protocols typically mandate a period of fasting, usually around 24 hours, to ensure the stomach is empty, thereby minimizing the risk of vomiting and aspiration during anesthesia. Astonishingly, medical investigations have revealed that individuals actively using GLP-1-based weight loss medications can still have substantial amounts of undigested food in their stomachs, even after adhering to the recommended fasting period. This unexpected finding necessitates adjustments to preoperative guidelines for these patients. Furthermore, both patients and their close contacts may notice the development of unusually foul breath and frequent malodorous burping. These unpleasant symptoms are a direct consequence of the prolonged retention of food within the stomach, where it can begin to undergo putrefactive processes due to the slowed digestive transit. While the appetite-suppressing effects are frequently lauded as a key to successful weight loss, it's crucial to acknowledge that this sensation often manifests as a generalized feeling of mild nausea or a diminished overall interest in food. Patients may describe feeling full even after consuming minimal amounts, and the enjoyment derived from eating can be significantly reduced. Nevertheless, beyond this primary effect on appetite, GLP-1 also appears to exert other metabolically favorable actions that contribute to weight reduction. Scientific studies have demonstrated that GLP-1 can stimulate lipolysis, the breakdown of stored triglycerides into free fatty acids, thus promoting fat mobilization and utilization for energy. Additionally, GLP-1 has been shown to enhance the activity of brown adipose tissue, a specialized type of fat tissue that is metabolically active and primarily involved in thermogenesis or heat production. Increased brown fat activity can contribute to a higher resting metabolic rate and a greater propensity for leanness. Now, let's broaden our perspective to include the class of drugs, often informally referred to as OIC, within fitness circles. While OIC isn't a formal pharmacological designation, it serves as a colloquial term for highly potent GLP-1 receptor agonists that exert particularly strong effects on appetite and food preferences. These medications can induce such a profound reduction in appetite that some individuals find it challenging to consume sufficient calories to maintain adequate muscle mass. Furthermore, a subset of users experiences significant and distressing gastrointestinal side effects, including severe nausea and vomiting. In rare and extreme cases, rapid and substantial weight loss has been associated with serious complications such as permanent vision impairment. Despite these potentially alarming adverse effects, many individuals who have used these drugs report that the unprecedented control over their appetite and the fundamental shift in their food cravings make the treatment subjectively worth it in their personal experience. The remarkable efficacy of these potent GLP-1 mimetics stems from their ability to closely mimic the actions of our body's naturally occurring GLP-1 hormone. This endogenous hormone is secreted by the gut in response to food intake, acting as a crucial satiety signal that tells us when we have eaten enough and it's time to stop. By powerfully amplifying this natural signaling pathway, drugs like OIC exert a dramatic influence on our overall energy intake. However, their effects extend beyond simply inducing a feeling of fullness. Emerging research suggests that these medications can also induce neurobiological changes, essentially rewiring the brain's reward system related to food. Studies employing brain imaging techniques have shown that while palatable, high-calorie foods typically activate reward centers in the brain, this response is significantly blunted in individuals taking these GLP-1 mimetics. Consequently, foods that were once highly desirable may become less appealing, and individuals may find themselves preferring and feeling more satisfied with healthier, lower-calorie options like lean protein and vegetables. This fundamental alteration in food preferences is a major contributor to the substantial calorie deficits observed in users of these drugs, often occurring without conscious effort. In fact, the impact on appetite and cravings can be so profound that the sales of junk food have reportedly experienced a noticeable decline, leading to speculation within the food industry about strategies to counteract these effects, by developing hyperpalatable snacks that can still trigger cravings even in the presence of GLP-1 agonists. However, while the weight loss achieved with these medications can be substantial, it's critical to consider the composition of that lost weight. A landmark publication in the highly respected New England Journal of Medicine shed light on this crucial aspect, revealing that a significant proportion, up to 40% of the total weight lost by individuals using GLP-1-based drugs, can be attributed to fat-free mass. This category encompasses not only water but also metabolically active tissues such as muscle and bone. To put this into perspective, for every 10 pounds of weight lost, as much as 4 pounds could be lean tissue rather than fat. This loss of lean mass is a significant concern because muscle tissue plays a vital role in maintaining metabolic rate and overall physical function. The implications of this lean mass loss become even more pronounced when considering the long-term adherence to these medications. Data indicates that a considerable percentage of individuals, around 70% in some studies, choose to discontinue these drugs within a couple of years. Upon cessation of treatment, the body often initiates a rapid process of weight regain, with many individuals returning to within a few pounds of their initial weight within another 2-year period. However, the composition of this regained weight is often different from the weight that was initially lost. While fat mass tends to be readily replenished, the lost muscle and bone mass, particularly in older adults, may not be fully recovered. This can lead to a phenomenon where an individual, despite showing a similar weight on the scale compared to their pre-treatment baseline, actually has a higher percentage of body fat and a lower proportion of lean tissue, potentially worsening their overall metabolic health profile. This is a particularly unfortunate aspect of human physiology. Our bodies are remarkably efficient at storing fat, but less so at rebuilding lost muscle and bone, especially as we age. Consequently, even if someone regains 95% of the weight they initially lost, the shift in body composition can leave them metabolically less healthy than they were before starting the drug. The question of whether tolerance develops to GLP-1 agonists, or if they disrupt the body's natural feedback mechanisms for appetite regulation, is a subject of ongoing scientific inquiry. Currently, the evidence does not strongly suggest that these drugs directly inhibit the body's endogenous production of GLP-1 by the intestines. However, some preclinical in vitro studies conducted on cell cultures have indicated a potential for reduced sensitivity to GLP-1 signaling with chronic exposure to these drugs. If this phenomenon were to occur in humans, it could mean that over time, the body's cells become less responsive to both the administered drug and the naturally produced GLP-1. Such a development could have significant implications, particularly when individuals decide to discontinue the medication. Having experienced weight loss, potentially including a reduction in metabolically active muscle tissue and a corresponding decrease in basal metabolic rate, these individuals might also find that their natural satiety cues are less effective in regulating their food intake. This could create a perfect storm for weight regain, where increased hunger and a blunted feeling of fullness lead to overconsumption at a lower metabolic rate, accelerating fat accumulation. This potential for a negative feedback loop underscores the complexity of long-term weight management with these pharmacological agents. It's crucial to maintain a balanced perspective when evaluating GLP-1 agonists. The initial lower dosages of these drugs, primarily indicated for type 2 diabetes, were indeed considered a significant advancement in therapeutic options. Their ability to effectively control blood glucose levels, coupled with the ancillary benefit of appetite regulation, presented a seemingly favorable balance of therapeutic effects versus potential side effects. However, the shift towards utilizing substantially higher doses specifically for weight loss has fundamentally altered this risk-benefit equation. As the dosage escalates, the likelihood and severity of potential adverse effects also tend to increase, necessitating a more cautious and individualized approach to their use. Furthermore, the pharmaceutical landscape is dynamic, with ongoing research and development exploring various strategies to optimize the therapeutic potential of GLP-1 agonists while mitigating their less desirable effects. This includes the investigation of combination therapies, where GLP-1 agonists are co-administered with other compounds that may help to counteract specific side effects or enhance their efficacy. The evolution of these treatment modalities will undoubtedly continue to shape the future of weight management. Turning our attention specifically to the more potent GLP-1 receptor agonists, often informally termed OIC within the fitness and weight loss communities, while their capacity to induce significant weight reduction is undeniable, it's imperative to have a frank discussion about their potential adverse effects. The terms Ozempic face and Ozempic butt have entered popular lexicon, often perceived as novel side effects unique to these drugs. However, it's more accurate to understand these phenomena as the visual manifestations of rapid and substantial weight loss, a pattern observed across various weight loss interventions. The generalized reduction in adipose tissue throughout the body, including the subcutaneous fat in the face and buttocks, naturally leads to these changes in physical appearance. This visual impact can be further accentuated by the concurrent loss of muscle mass. On average, individuals undergoing weight loss without targeted resistance training and adequate protein intake can lose a significant proportion of their weight as muscle tissue, often around 20%. The potent appetite-suppressing effects of OIC can make it challenging for users to consume sufficient calories and, more importantly, adequate protein to preserve lean mass. The resulting caloric restriction can also lead to decreased energy levels, hindering the ability to engage in the very resistance training that is crucial for mitigating muscle loss. Consequently, the combination of fat loss and muscle loss can make the aesthetic changes associated with rapid weight reduction more pronounced. Beyond these body composition changes, the most commonly reported side effects of these potent GLP-1 mimetics are nausea and vomiting. While for many individuals these symptoms tend to subside as their body gradually adapts to the medication, they can be quite debilitating and persistent for others. More concerning, although statistically rare, are reports of blindness associated with rapid weight loss induced by these drugs. The proposed mechanism involves a sudden drop in blood pressure, particularly at night, potentially leading to insufficient blood flow to the optic nerve. While extensive studies have not definitively established a causal link, these anecdotal reports warrant serious consideration and highlight the importance of careful patient monitoring. The prevailing medical consensus emphasizes that these powerful medications should be prescribed judiciously, reserved for individuals with significant weight-related health risks, where the potential therapeutic benefits are deemed to outweigh the potential for adverse events. Therefore, a critical question for anyone considering or currently using these GLP-1-based weight loss drugs is, what are the long-term implications and what happens when the medication is discontinued? Extensive research on conventional weight loss strategies reveals a discouraging trend. The majority of individuals regain a substantial portion of their lost weight within a relatively short time frame. A comprehensive meta-analysis of long-term weight loss studies indicated that, on average, individuals regain approximately 50% of their lost weight within 2 years, and after 5 years, almost all of the initial weight loss is typically reversed. Unfortunately, a similar pattern of weight regain appears to be associated with the cessation of GLP-1 agonist therapy. In a very real sense, these drugs can effectively address one of the primary physiological drivers of overweight and obesity, the powerful hormonal signals that regulate appetite and satiety. However, when the exogenous support of the medication is removed, the individual is often confronted with their pre-treatment physiology. After months of experiencing significantly reduced hunger and diminished food cravings, the body's intrinsic regulatory mechanisms can reassert themselves. The familiar pangs of hunger, the dopamine-driven reward response to palatable foods, and the psychological urge to snack or overeat can return with increased intensity. Studies have shown that, on average, individuals regain a significant 2/3 of the weight they lost within the first year after discontinuing drugs like Ozempic. This high rate of weight regain often leads to the clinical recommendation for indefinite treatment in many patients. From a pharmaceutical industry perspective, the prospect of long-term, potentially lifelong treatment for a widespread condition like obesity represents a substantial and enduring market. However, for individual patients, this translates to a significant and ongoing commitment, both in terms of financial cost and potential long-term side effects. In some ways, the use of GLP-1 agonists for weight management can be conceptually compared to hormone replacement therapy. For individuals with clinically diagnosed hormonal deficiencies, such as low testosterone, exogenous hormone administration can restore physiological function to within a normal range. However, this therapeutic use differs significantly from the supraphysiological use of hormones for performance enhancement. Similarly, for many individuals struggling with obesity, the underlying issue is not simply a lack of willpower, but rather a complex interplay of hormonal and neurological dysregulation that makes appetite control exceptionally challenging. GLP-1 agonists can help to normalize these physiological imbalances. The initial, often rapid, weight loss experienced by individuals starting GLP-1 agonist therapy can be a powerful motivator, creating a positive psychological shift and potentially improving their physical capacity for exercise. However, a notable aspect of these drugs is their ability to induce weight loss even in the absence of significant lifestyle modifications. This has led to some criticism, particularly within the fitness community, where the emphasis is often placed on the importance of diet and exercise as the foundational pillars of sustainable weight management. The perception that a drug can bypass the need for hard work and discipline can be a point of contention. However, for individuals with severe obesity and significant metabolic challenges, the initial weight loss facilitated by these medications can provide a crucial starting point, creating momentum and improving their ability to engage in healthier behaviors. Despite this potential, even individuals on these medications who remain open to the idea of exercise may not always prioritize it, yet they can still experience significant weight loss due to the drug's potent effects on appetite and metabolism. Looking ahead, the trajectory of GLP-1 agonists and related drugs suggests an increasing role in the management of obesity and metabolic disorders. Their demonstrated efficacy in promoting weight loss, coupled with an evolving understanding of their long-term safety profile, positions them as significant therapeutic tools. As patent protections expire, the anticipated arrival of more affordable generic versions and the potential development of even more refined and effective formulations could broaden their accessibility and impact. Furthermore, the clinical criteria for prescribing these medications may become less restrictive over time. It's conceivable that in the future, GLP-1 agonists could become a more widely accepted and utilized intervention in the ongoing efforts to address the global obesity epidemic. However, regardless of the evolving role of GLP-1 agonists in medicine, the fundamental principle remains. A healthy lifestyle cannot be entirely outsourced to a prescription. While these drugs can be powerful tools in managing weight and improving metabolic health, the benefits derived from a well-balanced diet and regular physical activity extend far beyond the scope of any single medication. These lifestyle factors profoundly impact not only our physical bodies, but also our mental well-being. influencing mood, self-confidence, and the cultivation of discipline that positively spills over into all facets of our lives. For those who are committed to making sustainable and lasting changes in their health without primary reliance on pharmaceutical interventions, I strongly encourage you to explore evidence-based strategies rooted in nutrition and exercise science. Thank you for investing your time in this detailed exploration of GLP-1 drugs. I encourage you to subscribe, like, and share.